We are setting out today our action plan, our battle plan, if you like, for dealing with the coronavirus. Now, right now, the number of cases, although rising, is relatively low, and we're still trying to contain this disease to that relatively small number of cases. And that means that so long as people wash their hands and catch a cough or a sneeze and follow public health advice if they've travelled to one of the affected areas internationally, then people should go about their normal business. We're not saying now that schools should close unless they have had a positive case in the school and have got the advice from Public Health England to close, and that events should be cancelled. But we're also setting out the sorts of things that we might have to do if this becomes much more widespread, to delay the onset, to research into the disease so that we can get as much information about it and preferably some treatments, and then, of course, to mitigate the impact if it does become really very widespread.
So is it a policy of containment or a policy of delay, Mr.
Well,
Hancock?
for now, it is a policy of containment. And we stand ready, if we need to move that up to delay the next phase in the plan. I very much hope that we don't have to, but there is a good chance that we will. And so we thought that the best way forward to be as transparent as possible is to set out the sorts of things we might have to do, even though we don't definitely have to do them yet. And this is quite unusual for a government. Normally, the governments say this is what we're doing and don't talk about contingencies. But in this case, we thought it was better for people to know the sorts of things that we might have to do, so that if we have to do them in the future, they don't come as a big shock and surprise. Instead, they are seen as what they are, which is part of a plan to deal with this disease, following the science, with as little disruption as possible, subject to keeping people safe.
At Cobra yesterday, what was the contingency? What were the numbers that we might be looking at of cases?
Well, there's a wide variety of the potential numbers, and we actually...
Well, give me a medium figure.
Well, the truth is that we don't...
No, I appreciate that, but you must prepare for a case, obviously. I mean, there's no point. Grown men and women sitting around, someone will have said, look, Prime Minister, at worst level, we might be looking at 20,000 cases, 30,000 cases, 500,000 cases. There must have been a figure.
Well, we have a figure for the reasonable worst-case scenario that we're setting out later today.
Well, what is that figure, Health Secretary?
It's quite complicated, and it'll be set out in the document later today. But
Sorry, what's complicated about a figure, a gross figure? Gross total.
Because that's not how we calculate it. And the reason for this is as follows, that in China, where obviously the outbreak is the greatest,
yes,
we don't know how many people caught the disease. The Chinese have put out figures, but the problem with the figures is that we don't know the number who have caught the disease but not had any symptoms. That's a really important fact. And we also don't know if the figures themselves for those who've been tested are accurate. What we do have more confidence in is the figure of the number of people who've died, but the proportion of people who have either got seriously ill or died, to work that out, you need to know how many people have caught the disease. So overall, we are making plans. Some of the figures are in the newspapers. We are making plans for a very significant impact on the population, for around up to 4 in 5 people to get the disease. But as soon as you talk about how many people might get it, there is also uncertainty on the proportion of people who will end up hospitalised and end up suffering so badly that they die. The important thing is that around 4/5, we think, of people who get this disease only have mild symptoms,
right?
A bad cough or what have you. And the critical thing for now is that the advice to the public is to do the things that we're recommending, washing your hands and catching your sneeze, but otherwise to go about your normal daily business, because actually we want to minimise the level of disruption until we potentially, if we get into a
So you don't see the need
scenario.
to work from home if you could?
Well, look, I'm not against working from home if your boss is happy with that. But for these purposes, we are not advising that sort of thing is necessary now.
Okay.
But we're also not ruling out saying that that'll be important in the future. And the sorts of things to expect from the plan are things that are particularly targeted on protecting those who it's already very clear are most affected by this disease. So people who are elderly or have an underlying health condition, much more likely to succumb to this disease, and so we'll see more targeted action on them.
And I note that you may call in retired or former NHS personnel, or that's a suggestion. Is that true, Mr. Hancock?
That is one of the things that we're considering, not least because, if an awful lot of people are ill all at once, then even though there's record numbers of people working in the NHS right now, clearly it'll be all hands on deck. And
but they might be elderly themselves.
Well,
by the very nature, by dint of being retired, so then surely you're exposing them to risk.
Well, not necessarily, and to a degree. So there's quite a lot of people who retire before the age of 60 in the NHS,
that.
But also the need for doctors,
what
for nurses.
What sense can it make for a well-meaning matron who hears the rallying cry? She's in her late 60s and she thinks, right, I should go and help because I gave 40 years of my life to the NHS and I'm there and they're around me. And then you give her coronavirus because you've called her into work. Where's the sense in that?
Look, it's a really good point, and there's a broader.
That's why I made it.
You're very good at making these
I make
points
a living out of it. I don't
probing questions, and that's what I expect. But the point I was going to try to explain is that actually we have that problem for people who work, health workers of all ages, people who work in the NHS,
of course,
because they. If this becomes widespread, they are likely to come more into contact with it than the general members of the public. Okay. And so we are already taking measures and buying protective equipment to make sure that we can protect the staff of the NHS as well as possible in the worst circumstances.
All right, Mr. Hancock, I like a dog show as much as the next person. You'll be aware that Crufts starts later this week.
Yes.
You may be aware that more than 300 dogs are coming from Italy. Should those dogs be allowed into the country?
Yes.
With their owners, of course.
Yes. So I'm aware of the issue around Crufts. We are not recommending the cancellation of large events now. And the reason for that is because the evidence shows that the impact, the epidemiological impact, the scientific impact is low now, although we don't rule out doing that sort of thing in the future.
But Italians arriving with their dogs, how wise is that?
Well, the thing is, there's different parts of Italy who are
so none are coming from northern Italy. You can't put your hand on your heart and say that, Mr. Hancock.
Well, there are quarantined areas of Italy, and that's where the biggest impact is.
Right.
But there have been people who've told me throughout this to stop the flights. The problem is that doesn't work, and I was told that at the start. And the only European country that did stop the flights from China was Italy, and they do have the biggest outbreak. So obviously, the critical thing is that people take precautions, and the precautions that everyone can and should take that doesn't have a disruptive impact, but does help to stop the spread of the disease, keep you safe, keep your neighbours safe, is to wash your hands.
All right. While I have the benefit of you on the line, two other questions. How much of a bully is Priti Patel?
I don't think that she is, and I've worked with Priti for many, many years, and I think she's certainly determined. She certainly wants to get her agenda through, but she's always been courteous and kind in all the dealings I've had with her. There's a process here that will be followed in terms of the various allegations, and I think we should allow that process to run through.
And lastly, how would you characterise at this time the relationship between Secretaries of State, Ministers and the civil service? Well,
in all of my dealings, and certainly in coronavirus, exemplary. I mean, the unbelievable working together 24/7 of ministers, medics and civil servants on coronavirus has been a testament to each and every one of them, and I want to thank them for the work that they're doing in the preparation for and response to this virus. People right across the country, people in my team here in London, in the NHS and in Public Health England, and of course in the department, people have been working all hours, and it's been a really, really good example of the system working as it should.